I'm often asked, when will the next pandemic occur? What if I told you that the beginnings of the next pandemic are happening now and that there are means to detect it before any humans get sick? This isn't something that can only happen in a Hollywood movie, but it can happen in wastewater, in baths, in hospital data, even in fragments of information scraped from the internet. That's what virus hunters do. That's what epidemiologists do. But I think the real story is not just about what we can detect, it's about what we can actually do about it. And I think it's important to think about virus hunting isn't just one thing. It's not just Indiana Jones trekking along by himself. It's a network. And it includes things like sampling animals in the wild, sequencing viral genomes, monitoring hospitals for unusual clusters, monitoring outbreaks that might be occurring in villages and remote areas, and increasingly scanning populations indirectly, for example, wastewater monitoring. And this is not something new. We've been doing this for influenza strains with the global surveillance and response system for influenza for decades and decades. What's changed isn't the goal, it's now that we've got so much data, we've got so much scale that we actually really can get our hands around this problem and increase the resiliency of the human species to infectious disease threats. I think one of the biggest shifts is genomic sequencing. Viruses, pathogens, they leave fingerprints. And we can read those fingerprints in real time using genetic sequencing. People can get diagnosed with an infection, they find a virus, they can upload that virus into a national or international database where people can look at it, can study it, can survey it, and understand where it fits in the family tree of pathogens or viruses. And from that, conclude things about it, how dangerous it is, how antivirals might work against it, how easily it spreads from person to person. That's all things that can happen now with genomic sequencing. During COVID, that's how new variants were quickly identified and characterized by using genomic sequencing. And it's a major advance, but it's still only part of the picture of this big network. Systems are now very digital, and and we live our lives on the internet. We write about it, we talk about it. And there are certain systems like the Epidemic Intelligence from Open Sources program of the World Health Organization. And what that program does is it scans massive amounts of publicly available data, news reports, social media, local alerts to try and find signals. The idea is to find an unusual pattern of illness before it's been formally reported. There's other organizations like Beacon, run from the university, from Boston University, where they're integrating genomic data into that same social media news stream as well, and trying to use AI to look for patterns, and they report that out to people who subscribe to their services. What they're trying to do is create a global early warning network. But obviously, there's one problem. How do you separate the noise from the signal between genomic databases, wildlife surveillance, wastewater surveillance, digital systems? We get unprecedented visibility into what's going on. But visibility isn't the same thing as understanding and being able to translate that into a plan, being able to understand when a signal really matters and when it may not be, when it might be spurious. And we're detecting more viruses, more things than ever before. But which ones actually matter? That's the key question. There's a lot of people that do virus hunting even before humans are even involved. They're going around, they're looking for viruses in the wildlife, bats, gorillas, whatever it might be. And remember, most of the viruses that they find out there are not going to have the capacity to infect humans, let alone cause a pandemic. Because finding a virus in an animal, a plant species, whatever it might be, doesn't tell you that it can infect humans or cause a problem for humans or spread amongst humans. So lots of data, but still there's that step to get clarity on what does this actually mean for the human species. One of the more practical ways to do this, one that kind of solves some of those problems, is to use wastewater. So during COVID, they could take wastewater from sewers, from airports, and look for different variants of COVID, look at the relative levels of COVID, and that can be expanded not just from COVID, not just looking at COVID, but influenza, measles, polio, antibiotic resistance genes, anything you really want to look for for the most part, can be seen in wastewater. There's also talk about doing this for blood banks, randomly swabbing people's noses as they walk through the airport if they choose to allow people to do that, just to see what's circulating. When the CDC is working on programs like this and it's scalable. But even here, there's a limitation. And I think that it has to do with what do these signals mean? How do you tie them to public health action? How big of a network do you have? What is your coverage? All of those, there's still limitations there. One of the things that I've really been interested in is using hospitals. So if you go in a hospital, walk through their intensive care unit, you're going to see people there in septic shock. Septic shock is the end stage from an infectious disease. And you can ask the rounding intensivist, the critical care doctor, what made this patient in bed 1 sick? What made this patient in bed 2 sick? All of them with septic shock. Maybe about half of them, they'll say, oh, this was E. coli, or this was COVID, or this was Pseudomonas. But in the other ones, they'll say, we don't know, but they're getting better. We gave them antibiotics. Nothing grew on our normal culture material. And I think that's what I call biological dark matter. You have people that are sick, critically ill, and you don't know what's making them sick. Not every infection is getting diagnosed. Patients come in with pneumonia, sepsis, meningitis, viral syndromes, and we don't know what actually made them sick. We treat empirically, we stabilize them, we move on. They get better or they don't get better. So we leave all that biological dark matter kind of on the table. And it's not that we don't have technology, it's just that the way that medicine is paid for, that some of those advanced diagnostic techniques might eat the entire revenue that a hospital gets from a patient. So there's no incentive to do these more sophisticated genomic studies on patients. But I think that's kind of short-sighted because it provides epidemiological data as well as provides patient-level data that's really important for the patient to know what made them sick. And it could serve as an early warning. Imagine if they were able to do that with the first cases of COVID that were occurring in November, probably, of 2019. So I think that it's really important that we also knit in hospitals and healthcare facilities into this genomic revolution, because I think that's one of the lower hanging fruits, because those people are already sick with something. So the yield is going to be much higher. And indeed, even if you look at people who die and start looking for infectious diseases in them, even if they were never diagnosed with an infectious disease prior to their death, you will find infectious diseases. For example, influenza. Influenza is one that you often find in an unexplained death. And there are others as well. And I think that's important part of the puzzle too, is to get medical examiners, coroners involved in this process. And I think most of the time we do find that there aren't pandemics occurring every day. And most infections aren't going to matter from a public health standpoint if they're just small clusters that are contained. They're not going to cause widespread panic and disruption of society. They're self-limited, they're manageable. And the system isn't really designed to catch every infection. It's designed to catch the ones that change outcomes. But I think that this is leaving a lot on the table and decreasing our resiliency. And I think that what ends up inevitably happening is we don't catch things in the earliest stage. And we detect it after it's already efficiently spreading in humans. That's exactly what happened with COVID. That's what happens with influenzas. And there's always this background spread that might be invisible to us because people might not have symptoms at all. They may not present for medical care. I've talked a lot about detection, but there's another piece of that that probably matters more. It's how we respond. And that's going to be conditioned by a few things. How severe is the infection? Who is at risk? And how can the healthcare system handle it? That's one of the biggest issues, is what is hospital capacity? What is healthcare facility capacity? And can it meet the influx of patients over a period of time? And that's what determines the impact. That's what determines the severity. But virus hunting does make a major difference because that's what leads to countermeasures. That's what allows them to make a vaccine faster. The work that was done on the first SARS and Middle East respiratory syndrome made it so much easier to make a SARS-CoV-2 vaccine in record time. Virus hunting leads to better diagnostics because you know how to test for these things. And antiviral therapies, including monoclonal antibodies, all of that comes from understanding what viruses are circulating and which ones are at risk. And not every virus, as I said, is going to be pandemic prone. And I've often advocated that we use a viral family approach to proactively plan for pandemics by doing virus hunting that's specifically targeted towards pandemic prevention, by looking at certain respiratory viruses from certain respiratory viral families and then developing countermeasures, diagnostics, vaccines, monoclonal antibodies, antivirals, and the like in those viral families so that there's knowledge that can be applied when some member of that viral family becomes a pandemic virus. I think that, to sum up here, virus hunters they're not pandemic fortune tellers. They help give us early awareness to provide for the basis for better tools, and they give us more time. And time is really essential when you're dealing with a fast moving, exponentially spreading pandemic. But it's not going to completely eliminate the risk. We're getting better at finding signals in genomes, in wastewater, across the internet. And that's a hard thing, but it's not the only hard thing when it comes to pandemic preparedness. What I think is the hardest is deciding what all that information means. What does it matter? And responding in a way that is going to diminish the real world impact of any of these infectious disease threats. Remember, the viruses, the pathogens, they're always going to be out there. The question isn't whether we'll find them, it's whether we're ready for the ones that actually matter.